as it is subsidized by the government. However, the Ministry of Health has indicated that this situation will evolve as a health fund will be set up in the future. Malaysians who can afford it will have to contribute. Another way to save on healthcare expenses is to engage with the local population. Local authorities are now trying to promote healthier lifestyles with preventive campaigns.
Our role is very simple. We help the NGOs to do the activities. We have some grant, we help them, we teach them, we coach them, and we evaluate the program. So make sure that health promotion activities can be carried out by the NGOs. And we see the impact, whether there is impact on the activities or not. This year only, we already succeeded giving more than 130 NGOs the grants. There's a great leap from 49 last year to this year about 130. You can see there's a lot of involvement on NGOs on the health promotion activities.
One of the key programs endorsed by the Malaysia Health Promotion Board in collaboration with the local state government is Malacca Free Smoke City. 4 key areas in the city have been gazetted and are considered smoke-free.
Malacca is recognized as one of the medical tourism states. So with this project, I think we boost the medical tourism activity.
This project was also driven by the local NGO My Watch.
We had to do the preliminary surveys and getting down all the facts and figures so that we can table it to the state health to convince them.
We have to move faster. We have to do a lot of health promotion activities for the communities. Because by doing health promotion, we can prevent a lot of diseases. With this program, I think more countries and more states, more cities, more towns can get involved in these activities.
Private companies are also taking an active role in the prevention sector. BP Healthcare Group, Malaysia's leading diagnostic centre chain, provides head-to-toe medical examination, lifestyle-related healthcare services and products.
Currently, we have 30 diagnostic centres, and among the 30, we have 2 specialist diagnostic centres, and then we have about 50 labs around the country. We are the first healthcare provider that offer a chain diagnostic center. And in a diagnostic center, we have doctors, specialists, and all the paramedic, nurses, and nutritionists to provide a one-stop center.
While quality is a priority for this company, as they have just received the Customer Value Enhancement Award in Diagnostics by Frost & Sullivan, local and regional expansion plans are also on the agenda. 2 new centres in Ipoh and Glen Marie are scheduled to open soon, and BP Healthcare Group has recently signed an MOU with their Thai partner, Max Healthcare, to penetrate this market.
Organically in Malaysia, we also experiencing quite substantial growth rate, and going to Thailand is another big task because Thailand's population is more than double of Malaysia, and we're going to focus one by one, step by step. Having another partner sort of leading us or guiding us is a very good thing, and they have been in the business for quite some time as well, but they're focusing more on the secondary and tertiary healthcare, and we are more on the primary healthcare. So this will complement each other.
I want to grow fast, but then this thing cannot just happen tomorrow. You need a lot of training, and people who join you must share the same culture. The success of the group is everyone have the same way of doing things, the commitment.
While Malaysian doctors are considered well-trained and professionals, many decide to practice overseas, motivated by higher financial gains. The medical industry is aware that its growth relies on the quality and availability of medical staff.
To attract them, you must have good environment, plus possible share equity participation into the company, and make them owners of the center. But because I have so many outlets, I can afford to open up my equity participation on that particular outlet, and that become very attractive to them.
The Ministry of Health is also taking measures to facilitate the integration of Malaysian doctors working overseas who are willing to come back.
First of all, we have cut down the compulsory service for all doctors from 3 years to 2 years in Malaysia. Those coming overseas, if you're a specialist, we can even waive that compulsory period. And when they come here, it is multi-level employment. That means the scale that they will be accepted will be much higher than before. So we'll take into consideration their qualifications and their experience and give them the appropriate grades. So once you go through that process, the one-stop center, it should be better now, and people should be coming back more now.
The medical tourism industry anticipates a great deal of growth in the coming years, from a 2004 estimate of $40 billion to $100 billion by 2012.
So with this Malaysia Health Travel Council, we are able to put up a strategic plan for health travel. Second, we are able to coordinate all our marketing program with all the healthcare providers. And thirdly is a one-stop center to resolve all the problems related to health travel. And it is an effective mechanism to promote health tourism in this country.
Our KPI is in the next 10 years, in 2020, we are expected to increase the number to 1.9 million. So that is about 6-fold increase in the next 10 years. As far as revenue is concerned, we have to increase it to 2.9 billion from what we are having right now, about 110 million. So that is a tall task for us. Our market is more concentrated on the regional market. We have probably about 70% Indonesians coming in as medical tourists, but we would like to extend this to the rest of the world. Probably a bigger market right now from China, from the Middle East, or maybe even to the US or Europe or Australia. There's a huge potential in our country to expand medical tourism, and we have more than 35 hospitals, and we are even opening up more facilities to be included in healthcare travel program. And therefore, there is a huge market outside where we can attract medical tourists in the country, and this will be a huge industry.
While other neighbouring destinations like Bangkok and Singapore have been marketing themselves for a longer period, the main challenge for Malaysia will be to change the perception or lack of awareness regarding its services and quality of treatments.
WHO says that the standards which Malaysia has displayed is of world-class standards. We created what is called Malaysian Society for Quality Health Standards. That's our own standards. About 3 years ago, these standards were adopted by the parent body of healthcare, which is the International Society for Quality in Health, or ISQA. And this body has endorsed the Malaysian system as being of international standards.